Now let's look at technology as a determinant. Technology as a determinant refers to how technology can structure our work for better or for worse. This can happen in many subtle or obvious ways, as well as not so obvious ways. If we have to use a technology that has part of its structure particular steps, then we have to follow those steps in order to use that technology. We don't have any choice in the matter here. The use of the technology and how we're using technology is laid out for us by the technology and by the people that designed the technology. I saw one example of this when looking at doctors using electronic health record systems. The systems were constructed in a particular way with a presumed flow to the clinical visit, as well as certain clinical indicators that may be required to allow certain tests to be approved. When medical records were done in a paper format or even electronically, but on someone's own laptop or desktop, they were primarily kept for the purpose of the physician. The physician had control over how that record was going to look. Even though they were using a computer, it was a facilitator, not a determinant, because they got to design, they got to decide how to use that technology. But when the technology now exists as a system, and if that system is rigid in terms of how it can be used, how it can be customized or modified, then that very same or similar technology can become a determinant. Once the records were not just electronic, but put into a system that was being administered by another part of the organization, this all changed. The idea of autonomy in terms of how it's used and if it's used changed. Doctors now had to put together and use records in a way that was more, pardon the pun, prescribed. And it's not like doctors appreciated this necessarily, because you had non-clinicians providing a system that was dictating how a clinical visit should go forward. It doesn't mean to say that all physicians don't like EHR systems, but in my conversations with physicians and other healthcare professionals, there was a certain amount of resistance and resentment to the systems because of how they constrained what physicians were doing and how those systems added another level of oversight in terms of if and how those systems were being used. And monitoring people's use of the technology or monitoring people through technology can be a big part of technology as a determinant. For instance, there was much resistance to the idea of having delivery drivers or bus drivers using GPS units to track their locations and their delivery progress. While the drivers were not necessarily using the technology, it wasn't like they were doing their jobs through the technology was nevertheless having an impact on how their work was being done. Likewise, managers could watch the number and rate of keystrokes on a keyboard. Speech analytic programs can monitor whether call center agents are following scripts and look at their rate of speech and their intonation of speech. As technology changes, especially when built into systems and analytic systems, the amount that a technology can dictate work increases. It's through this oversight and the structure that technology can dictate work. Now, this doesn't mean that workers don't push back against these determinants. And lack of implementation and use of technology can be, in fact, a way of resistance around technology as determinant. They can find all kinds of ways to work around or ad hoc systems to allow a measure of compliance while retaining a certain amount of autonomy. And so when we're thinking about technology as a determinant, we want to also think about the extent to which the users, the employees, were involved in the selection of, the design of, the evaluation of that technology as well.